Hi, I'm Lee McGuire, and I'm here with Dr. Doohi Lee discussing regenerative medicine through the diamond matrix. Now, this is a lot because regenerative medicine is really from head to toe. And
Yes.
explain a little bit about
And inside
that.
and outside.
Right, inside and outside.
Yeah,
Yes.
Yeah. So the reason I think regenerative medicine fits in the diamond matrix is because it's a very integral part now of modern medicine. And there are various different components that make up the concept of regenerative medicine.
It's very advanced medicine.
Yes,
That's
and
right.
as state of the art as you can get, and many different aspects of medicine that some people may be familiar with or may not. And just the term regenerative medicine tells you something. Regenerate means creating something anew, right? Where does an external idea of regenerative medicine come into play?
Stem cell therapy, is that
Stem
the
cells
main?
one,
Is that the
yes.
main part of
That's
it?
not necessarily the main part. It certainly is a big part of it, but it's not the main part. I think probably the main part has to do with hormonal balancing and the tie-in between optimization of your hormonal system.
That's for men and women. So
Both
when
men
you
and
say
women.
hormonal, people
yeah.
always automatically think of women.
Because of menopause.
But it's very important
Exactly.
for men.
Men go through just as much as women do.
course.
We just never admit it. So the whole idea really has to do with optimizing your internal health, and that's where hormonal balancing comes into play. So stem cells is the modern approach to this. Question has to do with how do we actually harness the advances in science to enhance our health and well-being. That whole thing has to do with the idea of how do we actually acquire the cells that literally build us to be who we are, from the moment of conception to development and growth and becoming an adult, etc. All the different tissues, from hair to eyes to eyelashes to liver and different organs, all come from stem cells. And stem cell medicine has to do with how do we actually take that scientific power and use that to enhance somebody's health.
Okay, now what is your main focus when you talk about stem cell therapy? Where have you applied that mostly at this
That can
point?
be applied in many different ways. I mean, most commonly people come in with questions having to do with joint problems. Knees are the most common
course,
joints. People
yes,
have arthritis, injuries,
yes.
things like that, athletes. So that's a very common area where you would actually inject stem cells or PRP or the combination thereof to help rejuvenate and sometimes actually regenerate cartilage. Something with muscles and tendons and things like that as well. There's a very large area of using stem cells for sexual health. Often for men especially, often they have erectile dysfunction. The hormones...
Erectile dysfunction?
Yes.
So you actually take stem cell to
You
treat
can do
that?
stem cells and PRP to, by judicious and a certain technique of injection into the penis, you actually help regrow the blood vessels in that area.
Interesting,
That
right.
enhances and enables the penis to get erect.
That's
and so that's a
incredible.
big part of
Right.
erectile dysfunction treatment. Not everybody does it for various reasons, but there certainly is a very advanced technique. We all start with hormones and other medications and things like that to help that, but beyond that level, this is a very cutting edge medical, scientific approach for erectile dysfunction treatment. You can actually use the same thing for women as well. Women have similar kind of problems from just purely physical and physiological effect of aging. They get atrophy and dryness in the vagina. They get, the thinning of the vulva area. So there's a lot of pain and trauma to the intimacy. So you can actually use the science behind stem cell medicine and regenerative medicine to actually regenerate and rejuvenate those areas.
Does that also affect how a woman's orgasm?
Yes. Yeah. You can actually enhance orgasmic response by, let's say, injecting certain, even PRP around the clitoral base and around the vulva area.
Everybody's going to be running in now.
Well,
This is going to
great.
be like the next. Forget
Line them
about
up.
everything else. Like, how can we go on?
Well, this is a great way to enhance this because let's say
Right.
for PRP, I'm taking their own cells and concentrating it and enhancing, blood flow and sensitivity of that area.
That's amazing.
I mean, it's really
Yes, that's
fantastic
really
technique,
amazing.
and this can be life-changing, and I'm really excited to be able to incorporate this as part of the Diamond Matrix.
Thank you, Dr. Lee. That was so exciting. We want to learn more right now. Let's take a deeper look into regenerative medicine through the Diamond Matrix.
Okay, so let's talk about another critical area in the Diamond Matrix, and this is the letter R, which stands for regenerative medicine. So the first area that we're going to be talking about is the idea of hormones and optimizing your metabolism in your body. So as you get older, these very crucial aspects of your health remain well maintained and controlled. So I talked another session about testosterone for one example. And this is something that I encounter a lot because I see men coming in with, often issues dealing with low testosterone. And most commonly is erectile dysfunction on the area of andropause. And we all know about menopause, and I'm going to get to that in a minute. For men, it's called andropause because as you get older, the testosterone production falls. It's just, unfortunately, it happens, but in reality, it happens to men just the way other things happen with women. So what happens when testosterone falls? Well, testosterone is the major hormone that gives you all the masculine characteristics. And women have testosterone, just not as much as men do, but women have it as well. And this is the hormone that enhances your muscularity, the strength, helps maintain your joints, the joint strength as well, but it's also tremendously important for your brain function, also maintains your libido, and so many other things. So once you achieve more optimal and enhanced hormonal levels, all of a sudden, my male friends, patients come back and say, God, I feel like a new person. I can think better, my memory is better, I don't have the brain fog anymore, I have so much more energy. Certainly my libido has improved, and I can run and exercise, and I really feel like much closer to what I used to be in my 20s and 30s and 40s. For women, it's the other side. Obviously testosterone is part of it, but their main issue is decline in estrogen and progesterone. As they get older, their ovaries shrink and the production of estrogen and progesterone falls. So that's just the nature of what they go through, and that is called menopause. And of course, women start with this with hot flashes, sweating, and of course they also go through mental fog and loss of energy, certainly decline in libido and all the kind of things that men go through, but they go from the women's side as well. So that's another aspect for women, is to evaluate their hormonal status in terms of estrogen and progesterone with various different tests and replenish that and to optimize their function. And in the middle of all this, an area called thyroid. Thyroid function declines for a lot of people as they get older. And that is a big, big part of energy and mental acuity. And the thyroid does so many different things in the body, a critical element as well. So that's all tied in to the overall assessment and optimization. So if you kind of think about this in a sort of a logical way, when is estrogen, or hormones for that matter, highest in us as humans? When you're young. In your 18, 20s, 30s, that's when the estrogen and testosterone, all those different hormones are really high, because those are the chief reproductive years. So when the estrogen is that high, why isn't there such high rate of breast cancer in women? Because that's when things are happening, when the high estrogen, right? And I understand there's a lot of women on birth control pills and as well, and some people do as well. But when you think about that kind of logic, it kind of makes sense. It's like, that doesn't really make sense why giving estrogen should increase necessarily breast cancer. And I'm not talking about people with genetic dispositions and DNA abnormalities and all that. I don't want to get into that kind of complexity here, because it just take us forever to talk about all this. But as an overall concept, high estrogen was happening when you're young, really not very high incidence of breast cancer. And when the breast cancer does happen when you're older, your hormonal status changes. And when women do get into replacement hormone, often it's done through synthetic hormones. And that, for me, is critical error. So my philosophy in terms of regenerative medicine, in terms of hormonal replacement, is really all about what I call bioidentical hormone replacement. Replacing the hormones with the same chemical, same hormones in chemical structure that your body produced naturally. So when your body sees this, it cannot tell the difference between the production of natural hormones from your ovaries or testicles to the ones you got. So the metabolism is exactly the same, and the end result of the metabolites and excretion and all those kind of things and the side effects of hormones are exactly the same as well. Of course, there is a danger level, and there is obviously a suboptimal level. You want to make sure that the replacement hormone is at a given level that is healthy, and you get the results that you want without pushing it too high. too much of a good thing is not a good thing. So too much of a good hormones is actually causes damage for both men and women. It is critically important to make sure that these hormones are well controlled and administered and maintained at an optimal level to give you the satisfaction and the health benefits that you want. There's a concept called platelet-rich plasma. So that is for me, the foundation of cellular medicine. So platelet-rich plasma, also known as PRP, what that is actually taking some blood, your own blood, separating the plasma from the red cells, and from the plasma spitting down the platelets. Okay, platelets are cells that are in our body. It actually helps you, clot when you cut yourself and does other things. But what's interesting is that when you concentrate the platelets and re-inject it into you, be it joints or even tendons or ligaments or muscles, those platelets actually have a very different property. I mean, you have to reach a certain concentration, and research has shown the optimal concentrations for different uses. But let's say you reach that concentration that you want for a certain therapeutic goal, and you inject that into the joints and tendons and things like that. Well, they actually act like stem cells. They're not stem cells by any means, but they have growth factors. They have other signaling cells and proteins that attract stem cells to that area. So this has been used for many, many, many decades all around the world, and certainly USA is no exception. But it is something that is not as familiarly taught or people realize that is readily available, but is a big part of regenerative medicine as the first step in the area of cellular medicine. The other part is called stem cells. The two main types of stem cells come from your bone marrow and, believe it or not, your fat. People don't really realize that, your fat actually has a lot of stem cells. So volume per volume, your fat cells actually have about 10 times more stem cells than bone marrow. Then bone marrow is something that we all hear about, and people talk about bone marrow stem cell transplant for leukemia and other blood diseases. So people are more familiar with the concept of bone marrow-derived stem cells. That's certainly tremendously important. But more recently, we realized that fat cells have a lot of stem cells that are just as effective in so many different applications. But certainly in the area of regenerative medicine, harvesting your own stem cells, concentrating that, and re-injecting it into your body, typically is joints. Most commonly it's the knee joints, but we've done stem cells in hip joints, shoulder joints and other joints, and many, many different applications in muscles and tendons and ligaments. All the areas that I mentioned that you could use PRP for, you can use stem cells. There are other places you can go. You can actually concentrate that and inject the stem cells back into your blood through IV. So you're getting a huge influx of stem cells that your body hasn't seen in a long time. The reason this is beneficial is because as you get older, the concentration and literally the amount of stem cells that are circulating in your body drops off very, very quickly. Even by age 18 and 20, the level of stem cells in your system is down by almost 80%. That's how quickly it comes down and slowly tapers down even further as you get older. And so when you're in your 60s, 70s, you're literally down to 2-5% of stem cells you used to have from a very young child. So that's why when you get older, when you injure yourself, even tweaking your muscles or ligaments, or even having surgery or any kind of injury, takes so much longer to heal because the stem cells are just not as readily available as when you're younger. So when you can concentrate the stem cells and inject that back into you in a large volume, or administer that into joints and things like that, the regenerative benefit of the stem cells are fantastic. That's why there's such an increase in interest in the stem cells and development of stem cell science to enhance regeneration and to perpetuate optimal health for so many of us. Now, in between the stem cells and the PRP is something called exosomes. And this is sort of the new wave of cellular medicine that is kind of taken over. Now, the exosomes are the actual vesicles. So I'll just give you a quick rundown on biology. When you inject stem cells into joints or muscles, the cells go to the cells that are already there. Now, the stem cells don't invade your native cells. You have to figure out, how do they do what they do? Well, they actually release something called exosomes. They're the actual vesicles in the stem cells that contain the RNA information, and the vesicles go and attach to the cells, be it muscle cells or other cells, they go inside those cells, get incorporated, and start replicating the RNA, and then regeneration signal from the stem cells. That's how regrowth and regeneration occurs. Is that transport mechanism from your stem cells to the cells already there, and the exosomes do that job by taking that information and allowing your native cells to start proliferating and growing and developing. So that's how the regeneration occurs. So there are companies that actually there are different labs that can actually develop these exosomes based on the tissue. You can get exosomes for muscles, you can get exosomes for nerve cells, exosomes for chondrocytes, which are cartilage things. So you can actually tune these exosomes towards certain applications. If you want to have knee joint injected, you probably want to get exosomes that are geared more towards joints. If you have muscle tear and you need some muscle regeneration, you want to get exosomes that are more preferentially geared towards muscles, and so on and so forth. So that is really, I think, a very, very important and developing area, and may actually even take over the idea of stem cells. So that's certainly an area that I'll be working on developing further in the area of regenerative medicine.